Time once again to Connect to Congress, a segment where we talk directly with Washington lawmakers who represent us here in the San Joaquin Valley. Right now, we are talking with Democratic Representative of California's 21st Congressional District, Jim Costa, live from his office in Washington, D.C. Congressman Costa, thank you for joining us today.
Good morning. As I say, it's always great to be on Great Day.
Yesterday, you and Congressman Adam Gray held a conference on Expanding Medical Education Act. Can you share with us some details on how you plan to use this to help people here in the San Joaquin Valley?
Well, this legislation is very important because we have a shortage of physicians in our valley, in parts of California, as well as other underserved areas in the country. And as estimated by the year 2034, which is less than 10 years away, that we could have a shortage of over 125,000 physicians. And the realization that we, as my mother used to say, if you don't have good health, you don't have anything. To have good health care, you need to have physicians and nurses, and we have a shortage of both of those. This legislation would attempt to address that by expanding funding through Health and Human Services to underserved areas where we're trying to build medical schools or expand existing medical schools. The San Joaquin Valley has the lowest supply of doctors in California, sadly, with a ratio of 47 doctors approximately to every 100,000 residents. And that is, frankly, unsatisfactory. And so what we're trying to do is take advantage of programs that we've been working on for a number of years. I have with the University of California, San Francisco, University of California, Merced, and Community Medical Center in Fresno with a residency program that we want to expand into a full-fledged medical school using both universities. University of California, San Francisco is one of the premier medical schools in the entire country, therefore the world. And clearly, this legislation with my colleague, Congressman Adam Gray, and with Senators Padilla and Senator Kane from Virginia, is an attempt to provide funding to expand medical schools throughout the country.
Just this last weekend, I was up visiting my folks up in the Bay Area, and I read in the San Francisco Chronicle, they had this really big story on how emergent or on-call personnel at hospitals up in the Bay Area were staying in their cars and in trucks overnight while they were on call in the parking lots of the hospital because they couldn't afford to live anywhere close to where they worked.
No, it's outrageous. I mean, there's that part of that equation as well. The Fresno Community Medical Center is the second largest hospital in California, and it is only one of 5 trauma and burn center units in the state that has the highest emergency room utilization. And it's a sad fact, but 150 to 200 patients every day at Community Medical Center are in the hallways because there aren't rooms to put them in. And so this is a crisis that we're dealing with, and we need more physicians, we need more nurses, and we need more access to critical care for health care for our constituents. I mean, again, every American ought to have the right to have access to good quality health care, and that's what we're trying to address.
Yeah, we've had friends in the hallway down here in Clovis and Fresno as well. I would like to switch gears because we only have limited time with you. President Trump is describing today as Liberation Day and scheduled an announcement for later today. What do you anticipate the announcement and how it could affect us here in California about tariffs?
Well, I'm very fearful of the announcement of further tariffs with Canada and with Mexico and other countries that I think is going to break out into a full-out tariff war. We've been down this road before, and I made it very clear with you and others. I'm opposed to tariffs, generally speaking, as a means to deal with trade inequities, and I'll tell you why. Number one, tariffs are a tax on American consumers. Number two, tariffs are a tax on American producers, manufacturers, and our agricultural community. In 2017 and 2018, when then President Trump in his first term enacted tariffs against other countries, it impacted, we believe, California agriculture by a tune of $27 billion throughout the country. But in our tree nut growers, we're the largest producer of almonds and pistachios and walnuts. It was $239 million estimated hit in 2017 and 2018. And I see that repeating itself. It's going to impact the Valley's economy, not just on our production of tree nuts, but dairy, citrus, and other key specialty crops that we grow in California. And 44% of our agriculture is exported. So I am very fearful of the combined double punch between tariffs and mass deportation that's going to hit the heart of our Valley's agriculture economy.
Well, we're going to add to that double punch because there are also concerns. We've got Supervisor Chavez talking about 52% of people in Fresno County get aid from the government. And if there are continued federal budget cuts, what can people expect when it comes to their everyday needs? Basic
Medicaid and Medicare are on the chopping blocks, as well as potential people who are food insecure, the SNAP program. And then we've identified, just with Supervisor Chavez and myself working together, $11 million in federal grants that we have identified, nine nonprofit organizations in our valley, like the Nice's Farmers League, that had a grant for $340,000 for testing kits and education materials to farm workers, which is very important. These people work with our farmers and ranchers to put food on America's dinner table every night, and that's a national security issue. I mean, what's more important than having food on America's dinner table?
Yeah, basic needs that are the question now is it something to be, is it a right, or do you have, only special people get it? Congressman Costa, Supervisor Chavez was saying that at least there are some organizations and some people who are opening up their wallets to help out, and maybe that will continue if the federal government continues to cut back.
It will be helpful, but I mean, last week we announced, and you covered, the cuts on food banks and food pantries under a USDA grant that we were able to access over the last several years. And those food pantries, those food banks, provide for the 5-county region very important nutrition for people that are food insecure, coupled with our other efforts that would provide funding for local farmers to sell their products to these places where they provide food for people who are in need.
And it's affecting the food banks even at our local colleges and communities. My students at Fresno State were talking about how the cupboard is also seeing fewer deliveries as well. Boy, so lots of punches. Congressman Costa, sadly, we are running out of time, but I do want to thank you for your time this morning.
Continue to update on these indiscriminate cuts. We ought to be using a surgical effort and not this meat axe approach that Elon Musk, who's not been elected to anything that I can determine. And I think Americans are wanting to have a much more focused effort to deal with our concerns and certainly inefficiency and waste, but at the same time focus on the needs that we have for research, for health care, and so many other important programs that Americans depend upon.
Thank you. Congressman Costa, great day. We'll be right back.